Okay, good afternoon, everybody. Welcome to the Center for Design for this last conversation of the 2024 fall series. And it's actually 50 years of this series, pretty long time. Yeah, very good. And I'm Paolo Ciuttarelli, I'm the founding director of the Center for Design. I'm very happy to host this conversation that actually connects with something that's very important for us. That is a fellowship that we started a few years ago. So the conversation series in general is our way to expand our network, our research agenda by exploring different new research topics or new potential relationships with scholars working through design, with design in different ways. You have here you can see some of the topics we touched on in the last conversations. The last one, last month, was kind of more on the technical side, like how emerging technologies can be reshaped, reinvented, leveraged to create new experiences. This month, we kind of change a little bit topics, and we want to use the opportunity to present some results about the fellowships that we launched a few years ago. The fellowships of the Center for Design have a similar scope, I would say, so there is a kind of alignment of intent with the conversations because we use these fellowships. We want to use them to explore potential connections or to create a new relationship with scholars that are interested in exploring design research as an area. And so, as the name suggests, really to create bridges with different areas in the college, especially. So, but not only. So we use both to connect with the university broadly, with Northeastern and beyond. Without further ado, the topic, we have two different topics today. That's kind of unique for the conversation. So we'll deal with mental health and design research and public policy and research of civic design. But I want to leave the stage and go to Laura Forlano, that is helping us with moderating the conversation, and she will also help us reshaping the Bridge Fellowships as we are working on that for yet another season launching soon. Laura, the floor is yours.
Okay. Okay, great. Thank you so much, Paolo. It's great to be here. I'm Laura Forlano. I'm a professor in art and design and comm studies at CAMD. And I'm pleased today to introduce to you two speakers that have been funded through this Bridge Fellowship. Sofía Bosch Gómez, who is presenting work on the role of design for social change in Latin America, and Michael Matus, who is working on technology-enhanced approaches to mental health. And I will be also facilitating the conversation after the two short presentations. So I think I will turn it over to you both. Do we know who's going up first?
And maybe just also introduce Beth Molnar,
yeah.
who's a professor of public health and health sciences, who's leading the project that I'm part of.
Maybe we can start from the current fellowship and then move into the new one.
Yes,
that's fine for you. So,
okay,
sure. What's going on right now?
So, you got the slide.
Yep, I'm manipulating the Zoom.
I have to stop sharing this one.
Okay. I'll stop automatically. Great.
Okay, well, I want to say thank you to the center for funding our pilot work on this new idea to move forward the work I've been doing for a long time on early childhood mental health. I've presented about this a few times in this group, so I'm going to go kind of quickly through the background of what we've been doing for the last 13 years or so, and set up what we have done with the funding from you and where we're going with it. And Michael joined me on the interpretation of the data that we've collected that we have here in the slides. So, next slide. So this has been a collaboration with the Boston Public Health Commission. Should I be looking there or to this group or in the middle? I'm not sure how it looks on Zoom or if
Yeah,
I'm even
slide on
showing.
your computer.
Yeah, I do. Yeah, so,
You can.
okay. Okay. So it's been a long collaboration with the Boston Public Health Commission, who has gotten a series of grants from the Substance Abuse Mental Health Services Administration, or SAMHSA, to help children, very young children, with social, emotional, and behavioral difficulties they're already experiencing even as early as infancy. And they have created this model that I've been the evaluator for them for going on 13 years, that we've tried in different contexts and different settings. And basically it's creating a case management kind of approach to their existing medical home care that they've been getting. In the first round of grants, we looked at whether this approach would work in pediatric primary care community health centers. We then had expansion grant money to take it out and do an effectiveness study of branching out to Worcester and Springfield sites as well. This most recent last 4 years, we did a step where we brought it into the child welfare department. So these are kids in foster care now. And so you're also talking about working with foster parents as well as biological caregivers who are still in, hopefully involved if they can be. And so the model is adding this family partner, which is a person with lived experience taking care of the child themselves with special health care or special mental health care needs. So they're trained to do a lot of this case management work, and they work very closely with a specially trained master's level mental health clinician who's been trained specifically in the disorders of very young children. And so that 2-person team, later on we add a third staff member that's a coordinator, but that team works with the pediatricians or works with the mental health providers, or works with child welfare in this most recent one to help identify kids that need this extra service and help their families through all sorts of things like housing and substance use disorder treatment and getting kids into kindergarten, and just really a holistic service delivery model. Very family centered and very focused on prevention of future problems. Next slide. So we've collected lots of data over the years to evaluate these studies. This is a very busy slide summarizing that, and we can keep going. The first major study that we put out from this was published in, I think, 2018, and we showed that there were significant declines in the behavioral problem of children in the receiving the intervention, and that those declines lasted over a year or so. In the blue, these are by age group. So the infants, the 1, 2, 3, 4, 5-year-olds, in the first time point, they're pretty much still under the clinical cutoff for emotional problems, social behavior and emotional problems. But in the year 1, we already see the at time 1 that the blue lines are above the clinical cutoff line that's in red, and that each age group has some of the kids already above that line. But then when we look across to time 3, all the green lines are down below the clinical cutoff line. So we had nice evidence of a shift in the average child in terms of their social emotional behavioral difficulties. So that's been great. It became an evidence-based program. It got an award for it from the Agency for Healthcare Quality, HRQ. This is how we showed the same results with the caregivers. So both parenting stress and depression symptoms went down over the year of follow-up. There's the award. And so what we had the idea for a few years ago, and then that we've pursued with this funding, is how can we enhance this intervention? And specifically, is there a way to use technology to enhance intervention. And so we started talking with families and started talking with the providers about, what would be some uses of technology that would enhance the way that you look at data, the way that you communicate between each other, the way that you check the progress of your children, the way that you organize the vast amount of information that's out there on the internet, all kinds of things that we thought technology might be helpful with. And so Michael and I had this fortuitous lunch where we met and we said, here are some ways that our research questions cross over, what can we do here? And so that's really the genesis of this and how we started thinking about how are we going to create this in a way that's user-centered and going to be appealing to people, understandable to people. And so that's really what this pilot step has been about. Like, we'll write a big proposal for hopefully the February NIH deadline, and this pilot data will be our preliminary studies for that. So you want to take it away and talk some about this development?
So some of the initial work that we've done over the past year is kind of trying to understand the scope of need within this population and how that need can be served through a local health intervention. We started out the process using a dyadic interview format. Since the challenges are really about facilitating a conversation between this family partner and the caregiver or family member who's the primary in the primary role of childcare. We chose a dyadic format to interview the two of them together so we can help them elicit some of the challenges that they've been facing, or some of the missed opportunities, some of the areas where they might have needed support but were unable to get it, and possibly map those to potential features that we could support within a mobile app.
Can I interrupt for a second?
Yeah,
So
it's not an interruption, it's an expansion.
it's like
Conversation.
expand for a moment, yeah. So one thing that we learned when we were piloting the pilot was that the family partner and clinician and caregiver, when we piloted this with somebody who'd been a family partner before, she brought up the idea that there will be some topics that they'll want to tell us different information, whether the other people are in the interview or not. So then we changed our protocol to have it be 30 minutes solo with one person, 30 minutes together, and 30 minutes solo with the other.
Yeah, a little bit.
That was
of a
our
mixed
definition of
right.
dyadic,
Yeah. But I think, well, we can get into some of the challenges in a later slide maybe, but I think it ended up being a really good model for this, and maybe going forward for these kinds of issues where these issue areas where there might be some, difficult information to communicate, or people might feel a little jeopardized in their role in the relationship, where there's maybe problems there, but they don't want to appear blaming or, deficient in some way in front of their collaborators. So I think that was a really nice element. Another thing that came up in our pilot of pilots is the scope of different cultures who are engaged with this program is really broad. What we have people in 7 different languages that they're actively serving. While we don't have folks that speak 7 different languages on our research team, we were able to collaborate with some really great translators. So the interviews we were able to conduct them in Spanish and Haitian Creole, Mandarin. Did we do a Mandarin? We had the capacity,
Yeah,
but I don't think we ended up recruiting Mandarins.
But yeah, I think it's in a future slide, the breakdown, I think 6 in English, 4 in English, 2 in Haitian Creole, and 2 in. No, we'll get to the slide.
We'll get to this slide. I'm tipping my hand. I think we talked about that already. Yeah, so this is the kind of underlying structure of the interviewing and the different phases of that interview as we helped them to elicit some of the challenges they were facing in this process.
Yeah, here we go.
There's our sample. See, I should have been advancing these slides at the time. Yeah, two things at the same time. So each interview included one caregiver who was involved in the home services, as well as a family partner who was involved with serving those folks.
And I left out that stuff. So in the current grant that we have now, the Alaska Public Health Commission, it's a combination of child welfare and the families that they're doing home visiting with. So those are primarily low income new parents that they're doing home visiting with. And so they're also introducing this integrated holistic care model to them. We're evaluating that, and that's primarily where we recruited the diaspora, was from the families and workers who are doing the home visiting.
And I think, too, in our prototype, or is that what we were calling it? The preview of the preview. One of the things, pilot of the pilot, yeah. I think one of the things that we learned too is like parenting. Parenting is very culturally local, and so in this pre-pilot, we got some feedback that parents are going to be more open and more able to speak about the cultural specificities of their parenting practices if they're able to do the interview in their own language, even if they're translating it to English. I think the quote was like, translating it to English just isn't gonna cut it. So I thought that was a really nice piece of feedback that we were able to accommodate in the process. And this is our translation model. Beth, if you want to say anything about any of these, just
Yeah,
feel free to
we've analyzed the data from the first 8 interviews and the first 8 pairs. And these are the 3 major themes that have come out of the interviews. So one theme, and we'll get into some quotes and details in the slides coming up, was a way that they characterized the current communication strategies between the pairs. Some of the issues that have arose with the families, and then we had to explicitly ask them this question about what would be helpful in a mobile app, and so we have a theme that summarizes that as well.
Some of the communication models that they were already using included texting, calling, and in-person conversations. So these this program that you have been part of for so long, the monthly in-person visits are a real key element to this. So we were hoping to use this mobile health app as an aspect that could build upon this very successful model already. Then using other communication modalities as a preference of the caregiver dictates. I think we talked a little bit about language challenges already in our research, but this also crops up in the model of support. So is, when the staff member and the caregiver speak the same language, of course, it's, communication is better and the understanding is better and a bit richer. These are a few quotes here. I can read them faster than I can say them out loud.
Although they're small for the people back there. The first one is really talking about this language barrier concern and how even translation services can inhibit the relationship.
The second one is on text messaging and it being a really good adjunct when you just can't talk on the phone.
And the third is from a client with a preference for texting, that it helps them keep from forgetting something that was discussed if it's in text. And that comes up again in the idea for the apps. Ideas for the app.
This is a set of service issues that that arise with families that were supported in our interviews. So needing tangible resources, you know, food, cleaning materials for the kid, housing cells, mental health support, liaising with other programs, applying for those, as well as fundamental healthcare needs.
The first quote here is from the Haitian Creole, one of the Haitian Creole pairs explaining culture shock of coming to the US from another country. And then the staff member went on to explain how they helped them adjust to new norms.
And the second quote is just dictates some of the care practices that are involved in this program and how important that is to the everyday living of these caregivers. This led us, so coding up these interviews, translating them to a set of app features, seems a little mechanistic, but I think it was really, really valuable to be able to extrapolate from a set of needs that were evident in a community to a set of approaches that might be able to support those. So again, this, I don't think any of us are looking at this as like a totalizing, we're going to solve your problems through this app, but more that this app can provide a really supportive and beneficial scaffolding to help support some of these families as they work together with the staff of this program towards better mental health.
Yeah, so things like having it incorporate Google, but in a filtered way so that they can get what they need from that, or having a group chat that's moderated by the staff so that they can have accurate information in there that they can trust, but also a sense of community together. They also, asked if we can have a translation method in the app so that they can turn on a language and have everything be in that language. So that's you or Herman.
Yeah. Translation APIs
Yeah.
through Google services or maybe ChatGPT.
Yeah.
Going to defer that decision until we get a grant in place.
And multiple people talked about having this be useful as reminders or check-ins or ways to keep track of the information. It came up multiple times about storing the conversation. So, we all have these text chains that are really long. And so having a way to have the organization of all of that within the app so that they can do searches from the family partner conversations. And then, having access again, like I said, to filter knowledge that they can trust.
And I think too, like it was nice because it maybe discouraged us from some of the features we had thought about that really nobody brought up. Like nobody really wanted to use this app in a sort of a situation where they maybe forgot how to do something and they're in the actual practice trying to do the thing. They look up how to do it. They were like, yeah, I will never do that. I just maybe look it up later. So that kind of more reflective knowledge access, I think, was a really valuable piece of feedback to get out of this set of interviews.
Here are some quotes about the features we just talked about. Keep going.
So our next step is to build this out in sort of for those of you who know Figma, the prototype, which is an apparently functional prototype of an app. It's essentially a very fancy slideshow that lets people click around in the app, and the app looks as if it's working, which will allow us to get some initial feedback on the usability and acceptability of this app as regards this feature set in the context of these folks' lives. and then developing a broader funding proposal. Screens, prototype screens that we've had for a little bit.
This is talking about one of the NIH institutes that we have our eye on, one of their RFPs right now. Request for proposals, so where this might fit in.
I have a question.
Yeah.
Is there a vision of who will be the sponsor or the validated trust kind of mediator for the app? I can imagine that one challenge is that to accept an app with information that is very sensitive or important to you. You're mentioning if you're trying to create like a filter, right? Like they don't go out and to the noise and they can find good information, which is great. But also there's this trust issue that I'm new in this country, trying to access information. Is there like an entity that is gonna be validating? Maybe I missed it from the presentation but I would just have like curiosity.
Yeah, and I think that's a really great question, and I think anytime you do a project like that, like this kind of question of technology transfer is always like, once it moves from the researchers to, so you know, just to, the short answer is it's gonna be our research team during this startup and development. If this proves to be successful, then there's a longer term model that we're gonna have to look at for technology transfer. And so does that end up being, you know, owned in perpetuity by Northeastern and the research team? Do we try to transfer it to the organization, which is, you know, like it's kind of a mixed, sometimes a mixed bag of, you know, challenges and opportunities. Organization could build internal competency to manage and maintain that app, or they might end up hiring an outside vendor to support them. Another option would be like licensing it to a third party, which then, you know, comes right back to this question of trust. So I think right now we're just trying to prove that we can help people in this paradigm, and then this is a really good, like, we'll check back with you.
Yeah, I'm looking forward to it. Yeah, I
No,
think because
it's a great question, because
Yeah.
we're gonna have to address that for sure in the NIH proposal.
if you're successful, which I
Create a
hope you
plan.
are, you're definitely gonna have to address it.
Yeah,
Looking
Great
forward
plan
to
for
that.
that, yeah. I was part of a project, I was a PI of a project that created a very detailed toolkit. We did 5 years of work to get it launched. And now it's stayed static on the Department of Justice website since 2017. And they've never opened another request for proposals like we sometimes do for us to apply to update it, you know? And so we don't get to update it. So I still have it at the bottom of my emails. I'm very proud of this toolkit about vicarious trauma. But it's a little hard now to say, go look at these resources that we put up 7 years ago. So yeah, we need a good sustainability plan for them to fund this.
And I think every piece of software, you know, is challenged by the same issue. I did a similar project with the city of Pittsburgh. One of the first responders maintained a Xerox list that he would like Xerox every year and give to all the other first responders
Wow.
of resources to give to folks that were living homeless at that point in time.
My son's pediatrician office still gives me like 20,000 version Xerox copies of what to do with my adolescent.
Yeah,
Like, here's what you do with the, you know, a 12-year-old, and he's 16 now, but you know, each year, like, I'm like, how many generations of Xeroxing did this document go through to get to this like faded, crooked, you know, piece of paper that I'm given by a Mass General managed primary care pediatric practice, right?
they're kind of weirdly beautiful once they go through that many generations of Xeroxing, but
Just say aesthetics.
yeah. yeah, that City of Pittsburgh thing, we ended up developing into an app and partnered with a not-for-profit who served people, people who are temporarily living without homes. And then they were able to manage to maintain it over the long term.
We have a question in the chat about this project.
Yeah.
They have asked,
Yeah, I think.
oh, okay, I can,
Yeah.
That's cool, yeah.
it's, they may have missed this from the beginning, but they're curious, were other solution types considered aside from a mobile app? Where did the rationale come from for determining the tool should take the form of an app? To buy an app, basically.
Yeah, I think that came from us speaking with the players in this intervention and then having that idea originally. It was never suggested to have anything different. When we brought in the idea of technology, you know, they're already, no matter how what your socioeconomic status is at this point, most people have a smartphone. And so the idea of just having another website didn't come up. And having something that was personally moderated by the family partner, like the idea of being able to communicate with their own family partner in it. Maybe meet other families that are being served, getting the services from the same family partner, like that all seemed to be mobile technology app seemed to be the way to go.
I think one of the quotes from those early interviews was like, what you know, would really like to have the family partner in our in my pocket, yeah. Oh, I love that quote. Say it
Just
every
harder
time
to
you
say
say
about a website.
Yeah, yeah.
So I think we want to move on to the second presentation, if that's
So do you
okay.
want to finish with the slide?
Or do you have some
No,
additional
that's fine.
slides?
I think,
Okay.
yeah,
Yeah.
we're good.
Yeah.
Okay, so we're gonna move to the second presentation, then we're gonna have more cross-cutting conversation across the two projects, if that works for you. Yeah, okay, thank you.
Hi, everyone. The project that is being supported by the Bridges Fellowship here at the Center for Design for this year, we titled it Co-Designing a Network for Public Sector Design Scholars and Practitioners in Latin America. So it's a long title, but we are thinking of brainstorming ways to shorten it. So this is a team where Pina, who is here with me today, and is a grad student here at Northeastern. Do you want to introduce yourself?
Sure. So I'm a master's student in the Information and Design and Data Visualization program. And I'm also doing a certificate in Digital Humanities. And I'm working with you in this fellowship.
So the fellowship is supporting Tina's work with us. Catherine Gore, who is an undergrad student in the program in the Art and Design department, she's doing a BFA in design and is supported by the Dean's Honors. She's a Dean's Honors Fellow and is working as well with us in the project. Diana Pamela Villalvarez, who is a researcher, an independent researcher in Colombia. Fede Vaz from the RCA, the Royal College of Art in London, and is from Uruguay. Both Pamela and Fede have been doing extensive work in the area of design for policy, specifically in Latin America. Diana Pamela more from a practical side, really working with government offices in Colombia. Fede has been working more as a consultant through different projects, not only in Latin America, but also in Africa. And then me, I'm an assistant professor here in art and design for policy is kind of my topic of research, with a big passion of developing it further in Latin America. So our main research question, what we were wondering when we were brainstorming this project, was how is design being applied within public sector innovation units across Latin America? and what are the opportunities that exist to bridge the gaps between academic research and practical implementation. One of the things we've noticed is that there is extensive literature on how to do how to apply design methods for innovation in government in different areas of the world. Europe has been extensively kind of researched. There are repositories on innovation labs. There is a lot of literature on how it's being done. There's also a lot of information on how it's done in Australia, in the UK. But Latin America remains a little bit of a black box. And it remains a bit of a black box because the political processes of the region are kind of tumultuous, right? They're contextual, I'm sorry.
Volatile.
Volatile, exactly, that's the word. And there are certain kind of conditions that don't allow for those processes to be as straightforward as they've been documented in other areas of the world. So our hypothesis, the way that we kind of started the project, were that design practices within public sector innovation units in Latin America are underdocumented, and there is a deep contextual variation. The way that innovation is sparked through design in Uruguay or in Chile is not the same than in Guatemala or in Mexico, or right? So within the region, there are very different contexts happening as well. And then there is an opportunity, right, to do participatory research within these spaces, but could a participatory research illuminate the way that they operate and simplify some of those connections that were being that we see published in academic research with the way that it's being reported from a practical point of view? Some of the units in Latin America do their own reports, they post them online, but because of the volatility, right, of innovation units, they usually are taken down with electoral terms. So there might be information for a certain period of time, but then it's taken down and that kind of disappears, right? So we were wondering, well, could we co-design a repository or a way to keep this information up there and that we don't need to be kind of inventing things over and over and over again? So why is this relevant? Well, we think it's relevant because design research and processes in the public sector have really the power to strengthen the way that we create and co-create services and alternatives for policy making, right? So not only the implementation phase of the policy cycle, but really also the initial part, the way that we conceptualize policy. So our main goal through this fellowship is document the work of innovation units that, again, they're vulnerable to electoral cycles and preserve their contributions to foster stronger and more informed connections for future research and practical work. So really have a place for people to go to in order to understand what has been done and what can be done. So in order to do this, we created kind of a cascading methodology for ourselves. We are starting with a robust literature review on the topic. Tina is going to present a little bit more on that because we've gone deep into that area this semester. From there, we want to identify key actors and reach out to them in order to do some topic expert interviews, subject expert interviews within the 22 countries of Latin America. Once we do this set of interviews, that will inform a set of surveys. We want to survey more than 100 public sector practitioners doing design work. And we're kind of building on the work that has been done before. Diana Pamela published a paper a few years ago where she did an extensive developed a repository of more than 400 laboratories, innovation labs around the world. And the methodology that she developed for that, we're kind of building on that for our project, as well as the work of Mariana Salgado, who has a podcast, the biggest, largest listening design podcast in Spanish and in Latam. So we're also tapping into Mariana's network in order to reach out to experts. If time is permitting, we would love to hold some workshop sessions just to think about the possibilities of the repository so that it doesn't become just an informative tool, but what could we actually co-create with it? How could we build it into something a bit more powerful? So I'm gonna pass it on to you so that you can explain the literature review part, because Tina has been just crucial in this process, and her interdisciplinary approach to the project has just brought it to the next level.
So thank you. So yes, so this semester we have delved into the literature review, and like Sofía mentioned, we are trying to build on Pamela's work, and we're trying to replicate her process. And in this while we're trying to define our own literature review and what would it be, we confronted the issue of languages. So it's a topic today. And because there's multiple languages in Latin America being spoken, specifically 4, and we didn't want to leave out any literature that was done in languages like Spanish, Portuguese, and French, given that those are strong languages in Latin America, and wouldn't make sense to leave them out and, you know, be very comprehensive and robust in our approach. But a challenge was, now that we're deciding we're gonna see these 4 languages, well, we have to replicate this system that Pamela created, and it would take a lot of time to do this process manually with the 4 languages that multiplies the keywords that need to be searched and therefore the final output. So we decided to try to integrate Python and some automation in our process. And that's where the idea kind of emerged. And so far, well, it's something new to us, but we're trying to leverage the resources in the Burns Center and in Northeastern to be able to learn how to best approach this. So we're working on it. The idea is to start the extraction of these first papers, and then there's a filtering of the content, doing PDF readings automatically with some specific words that we have chosen. And then from the initial Google Scholar outputs, we are kind of filtering a few automatically, and then those we're manually validating for relevance in our research. So we have learned that there's, in this automation process, we also need to be very aware and sensitive to where do we need to validate and how much critical thinking and in which are the key points where we need to make those validations. So after that, we're trying to leverage, because we are expecting, given the automation, there's another challenge. Now you have a lot of information to process. Before, because you're one person, you limit yourself, but now you have the machines, you have a lot of information, and you want to be robust. So the idea of Notebook LM and using AI to have a preliminary summarize of the then validated papers that we chose as relevant came. And we're working with that idea. We're very excited to try to incorporate these technologies in the research, and hope that it will give a broader view of what's out there compared to things that have been done in the past in Latin America in terms of literature review for designing public policy. So some of the key quick outputs that we have worked already with Spanish and English, and it's interesting to see the output. So with English and Spanish, there's very interesting, we had to work with the translation. So we started with the English words, and also what are the translation in Spanish that are not literal translations, but used in practice. So we had to validate that with the experts, local experts. And we have done that with French and Portuguese. But so far we have done the English and Spanish automatic extractions of the literature review, which gave for Spanish, for English 140 results, given that we scraped the first 2 pages of Google Scholar for the keywords.
That's a total of 20 articles because each page has 10 hits. And then for Spanish, we had more words. Usually, Spanish speaking people use more words to express the same thing. So you can see that culturally it's reflected in our keywords. So we have more outputs at the end, of course. So it was interesting because the way we filter after we extract those paper, we decided to filter for the keywords public sector, Latin America, Caribbean, and then all the countries individually of Latin America. I believe that it's still 29. So the results for English and Spanish, the initial ones seem bigger, like a bigger percent in English that might be relevant, but when you look closely to it and in the verification, most of those hits that appear in the automatically PDF reading as relevant a lot of them deal with the public sector filter word. So they actually don't contain Latin America in it. And it's interesting for Spanish, there was at the end more, but we're still in the process of. Yeah.
And I think something interesting on all of this, it's kind of validating. We need to really dive deeper into this, but it's kind of validating our hypothesis, right? The fact that the way that we talk about design in innovation in Latin America is underreported. And maybe there's a couple of distinct case studies that are mentioned, but there's never an in-depth process analysis of what is happening. So it continues to be black box. And then, this was kind of our next steps. We are looking forward to doing interviews and surveys. As I mentioned, we want to do 2 subject matter expert interviews in every Latin American country. These are 22 of them. And a survey with over 100 designers in public sector working in these topics, plus the workshops and then the writing. We are aiming for May because in May, the Laboratorio de Gobierno in Chile will be turning 10 years. It's a decade of its operations, and it's the only innovation lab in Latin America that has been running regardless of it's kind of been able to survive electoral terms. So they will do a bit of a big event for that, and we really want to have whatever comes out of this be presented as part of that event because we believe it's relevant for them and for other labs in the region to be sustainable and be sustained. So that's all we have for today. Thank you.
So I have a couple of cross-cutting questions about the 2 projects. I think one of the most interesting, that Tina, you already hinted, is about design for diversity and specifically what it means to both collect data that's multilingual and sort of what are the kind of gaps there, in terms of just what's available, and then also for the project itself, sort of how might that multilingual aspect, does that mean publishing in multiple languages, or what are the venues that you can also present this research that are in different languages? So like, how does one do a research project that is expected to navigate different language groups? And then I think, for the first project related to design for diversity with respect to the app, and you talked a lot about the potential for maybe multilingual use of the app. So the bigger issue for the design field is also how do we train design researchers who become more comfortable in, of course, Northeastern being a very international community, we have many language groups that we don't necessarily highlight or build into our project. So how do we think about that as a design field and also at Northeastern?
I mean, came up in our initial planning with the Public Health Commission that this was going to be vastly more informative if we were to find some research assistants who spoke their two most popular languages, which are the Haitian Creole and Spanish. And so that, you know, took more time because we had to find those people and get them trained, and everything, but, definitely worth it, you know, to be able to get those different perspectives for us, yeah.
Ellen, oh, sorry, and it's maybe like, in our conversations, about doing this process, I think it's probably even a little deeper than like, these are incompatible codes, you know, it's more that like, these are like, different perspectives on living, and child raising, and so, you know, being able to, I think the language piece is just the gateway to those perspectives. So we, you know, necessary to walk through.
Yeah, I wanted to mention, so when your project was being presented, I was thinking about this, was like, I am a bilingual mom. My kids grew up mainly between United States and Europe, so they're more comfortable with English, but they understand well Spanish, especially when I need to make something clear. It's Spanish, and that's what comes out of me. So I was relating a lot about, you know, tapping into the, you know, your native language and into be able to get that trust and comfort of expressing what you really want to express. I think that's very key, especially in design, right? But also one other thing that I was connecting in terms of as designers, you know, being able to tap into technology, because it used to be before that we depended on human translators to be able to be more, you know, user or you know, user-centered or human-centered, and those were limitations. And now with the technology, we can lower those barriers, but then it comes the question, you know, we need to also be aware and sensitive of that. As humans, machines also do mistakes. So it's how do we navigate and define our behavior and our methods of designing and these checkpoints, right, to ourselves to be able to be comfortable with the technology, because it can lower these barriers, but also that we don't be blinded by the ease of them. So that's something I wanted to bring up too, but I see how that, you know, being in a more connected world now, it's part of it. The multilingual approach, I think it's just gonna be more and more common and more accessible because we have this technology that we can plug it into our research easier in some ways. Yeah.
And I think in that sense, something that we've been discussing a lot, Tina and I, beyond kind of the diversity of languages within the project, is more how do we create these systems where you have humans and new tech basically collaborating. This idea of co-creation or co-design kind of goes beyond just human co-design. So for example, for us, it was very important to have those lists of keywords that we use for the scraping to be validated by experts. The French words were validated by the director of the one of the biggest labs, innovation labs in France, right? And he just gave us a couple of nuances that the technology didn't give us when we translated them that were extremely valid, right? So I think it's kind of expanding that idea of co-creation or co-design and really thinking how we can leverage those technologies in those processes.
Great. Thank you both, or thank you all for your responses. And I have another cross-cutting question, which is really about data systems and data infrastructures. How do we, and if I were to put it in sort of academic terms, you know, there are these big discussions right now about themes like maintenance, care, and repair within data infrastructures. So both projects mention surviving electoral changes and like, how do you make sure that the resources that you create today in a project could, one, be still available in the future, but also will be funded in the future. And so it's about legacies in our work as designers and how we, I think designers often work on short-term projects that are fairly, smaller, and getting opportunities to work on longer term projects that have the ability to be around, in 50 years or in 5 years, I think it's something that maybe we can think about more as a field.
Sorry, it's just something that we've been trying to integrate since the beginning of the project, thinking about the maintenance of this network that we want to create. We want it to be a visual network where people can also have access to a repository, but how do we make that sustainable in the long run? How do we make it a kind of independent space where regardless of those changes, electoral changes, it can survive? And so that is something that, for example, we've been in conversations with the team at the Burns Center because they've been really good at doing that with the repositories from the GovLab, which have been up for more than 10 years. And that is pretty rare, right? So we're trying to integrate that part, and it's something that we're very kind of eager to dive deeper into. How do we make this sustainable and something that we can maintain in the long run?
Wanted to bring the support that we've had from the Burns Center, but I also think it's a challenge to start or maybe frame or how we frame or support our systems, right? Our administrative systems in terms of technology and being able to give our researchers what they need when they need it. As we see that technology pace keeps speeding up, it's hard to do your own focus of expertise and keep up with the technology as fast as it's going. And I think it's for departments that's gonna have to be more and more, how do we support our researchers so they can be focused on their expertise and don't worry about not having the resources that they need. So yeah.
And I think it's a huge question for public health in general, not just research, but the NIH, has been stably supported by all political parties over the past 70, 80 years. Like it survived the previous Trump administration fine because it's been very respected, and there were enough people in the Congress to protect it and not have it have any big cuts. I don't know if that's going to stay that way with the incoming administration. So, figuring out ways that health and medical research, public health and medical research can survive the next 4 years is going to be, something we're all going to have to work on, I think. And, a lot of the people in the care of the Public Health Commission's work are immigrants, and that's only going to get harder to be an immigrant in this country in the next 4 years. So I think both of those have to, maybe we can learn from places where there's been more tumultuousness of administrations affecting health systems than ours have been up to now.
Now that you mentioned this, I'm so sorry.
No, go ahead.
I was just gonna say that it makes me really think of the example of Argentina, right? And the Milei approach of creating this hyper efficient government and cutting down, creating these austerity measures, really like bringing it down to the bare minimum, right? And I've been in conversations with some of the designers that are still working there, and it's really interesting how they're trying to do everything to keep those systems alive and maintain them. So I think there's something that we could learn there that could be kind of a sort of good practice when these sorts of electoral turns happen, I guess.
I think some of the environmental health people are models for me to follow, because I had the opportunity to have one of my colleagues in that area speak to my undergrad class this past a couple weeks ago, and talked about how while the EPA, the Environmental Protection Agency, while the EPA is in ashes the next 4 years, these are the things that we're going to do to keep our work on chemical exposures going. So they learned from 2016 how to protect some of the data, bring them off the EPA website, put them in a secure place, put them back up in 2020. So I think there are some strategies that we can learn from people like that.
Maybe I'm more cynical, but I think like this, all this talk of government efficiency is just code for we want to cut programs we don't like. And there's really no pretensions at all to government efficiency. It's just, you know, we want to be able to freely give money to multinational corporations and billionaires and privatize more of the economy and financialize sectors of the economy that haven't been financialized yet. So waste is great over there, but like giving food to people who need it or healthcare to people who need it, we don't care for that so much. So that's, you know, going to be removed in the name of efficiency. Yeah, I don't know. I'll stop right there because
Shoring things up in states is one strategy for that, right?
I think so.
Like having the state of Massachusetts have and California and others have been money set aside infrastructure to, you know, California just put $25 million in the fund to do nothing but sue the Trump administration, right? Like they did 4 years ago, 8 years ago.
I don't know, but maybe to come back to your original question, because I diverged a little bit there. You know, the problem of practice-based innovations in social contexts, I think is transferring those from a research context to an everyday practice context is another one of those things, like who's going to own the app after our research project is done. That question of practice-based innovation is one that's just like durably difficult. There was a study done not too long ago on the uptake of practice-based innovations among nursing and hospitals, and almost invariably when the study ends, the practice innovation ends, regardless of the quality of outcomes it has on the patient experience. So, you know, there's a project where they're trying to provide better sleep for patients post-surgical. And so the hospital got a closet full of like noise machines and, you know, the little charts that show the doctor like, don't, you know, or that show the lab workers, don't come in and draw blood while this patient is sleeping. As soon as the study ended, those things were, as soon as they broke, you know, nobody bought a new noise machine. And as soon as they lost the chart that, or the sign that went on the door that said, or the magnet fell off, nobody restored the magnet. You know. So uptake of those practice-based innovations in a durable way in systems is a real challenge. And I think like it's a, you know, designers who are systemically oriented in their practice have a real opportunity there if they can crack that nut.
Yeah, great. Well, thank you all. This has been amazing. I think we, at this point, we do want to take some more questions from those of you here in the room and also anyone who might have asked a question in the chat online as well. Is there any question in the room? Yeah.
Okay, you guys mentioned key factors. Could you give me an example?
Maybe repeat the question for everyone else.
So we mentioned key actors. So the question is which key actors? And so that's something we're trying to identify through connecting Mariana Salgado's work with what we're getting from the papers. Because key actors that might have been reported in the paper. So an example, one of the papers talks about the lab for the city, Mexico City, right? And a key actor would have been the director, right? Gabriela Gomez Mont. Gabriela is not working in that realm anymore. So currently right now, she's not considered a key actor within our study, within our research. But there's others, right? And so we're trying to cross that with Mariana Salgado's kind of podcast list that she has done an extensive work on basically interviewing everyone in that realm and seeing, well, who is actually still working in there and who can give us context, right? They might be subject matter experts, but not key actors that are working in that area right now. So we need to kind of disaggregate. It's kind of, we need to do a sort of taxonomy, right? To see like what has been done, who has done work in this area, now who is doing work currently in that area, and what is being done. What are the methods, what are the metrics, etc.
What is your, like what is the top of your taxonomy, let's say? Like you're looking for actors as people or actors as institutions or actors as?
That's a great question. Thank you for asking that, because we've been talking about that. That's gonna give us a kind of a framework for the visual network. And we were thinking that we wanted to do it as institutions, people, and projects. Because through institutions or agencies, those may survive electoral terms, but they may not, right? Like the example I gave you, Laboratorio para la Ciudad doesn't exist anymore. So if you search it online, you'll basically find no information about it. So then if you go to projects, you might find a couple of projects here and there, but everything has basically been taken down. But if you go to people, there's a lot of people that through LinkedIn, for example, report having worked at Laboratorio. So there's ways of tracing that history back through those 3 different channels. So in some cases, it might be people, some cases might be projects, in some cases it might be the actual agency, but we need to figure out how to make that visible in the network.
But I want to add, I love this project. I came into this project because I'm interested in networks. So when I saw the post, I immediately said, this is a collaboration network and we can actually map it like that. And I'm a newbie in networks, but very eager to learn from what Northeastern has to offer. And one key thing that I learned is that we need to find things that we can trace. So we can go back in the network and go forward in the network. And that in this case, it's people. That for sure, it's one node that we need to have clarity, because you spend a lot of your effort creating this expertise and outpouring it to the service, yet you can probably work with government and then work in the private sector or in academia and move about, but still the people remain, right? Or they're the more permanent. So it's something that has come up in our research and we're very excited. We think that it's a new way of approaching our research, and I think it will be very, we could do many amazing things with it.
And which kind of connects to Laura's last question about maintenance, right? I think a transversal topic with people working in innovation in the public sector, specifically in Latin America, is that they see it very much from an activist perspective. They're kind of activists within the institution. And so they are the maintainers of these projects, of these topics. And I think that there's a value to that as well.
And then I'll just add, have you guys thought about how to do that? Because schools, universities, and they are basically like for example, in Mexico, some universities basically form all the economists. So, I mean, just targeting those would probably help a lot.
Yeah, we've also.
Yeah, so it has
Yes,
come up.
thank you for the recommendation.
And it's very interesting because in terms of information, if you go out in the digital and start to just Google, try to search for these collaborations or these topics, hubs of information might be different than hubs of practice. And we have seen both. So it's very interesting even how to define and create this taxonomy in this way. Yeah, but
Have you thought about the actor network theory of the tool?
Yes, that can also, yes. I think once we dive deeper into the taxonomy of it, once we go through the literature review and we actually understand what's inside those reports, we'll have to go deeper into how to.
This may help understanding how to look at actors.
I will look
Both
into it.
human and non-human.
Yeah,
Exactly.
I'm working with Dario in my thesis, so he has worked closely with, so thank you for pointing it out.
It was kind of obvious.
Do we have another question here in the room or online?
I have one, if I
Okay,
may.
yeah.
I was curious about how would you frame the contribution of design? So in your, it's a bridge that you have created and this fellowship, and was design helpful at all? If so, how? From different perspectives, from your discipline. disciplinary angle. So what did you found, or what did you find interesting in having that relationship in research with design?
Well, I think, designing the pilot was clearly informed by, we didn't mention, we have another collaborator from computer science, Herman Sexano, and another who is a biostatistician, Farzad Newberry. So it's been a really rich team with all these different perspectives. And so creating a product someday that will incorporate the computer science expertise and the statistics and design expertise into it can only make it better and more sustainable. So I think we did go quickly through some of the ideas and prototypes that the team has already had on our own without the input of the people we've now done the dyadic interviews with, and now we put that all together and make a great proposal for something that's going to be, innovative in its design and its computer science capabilities.
And it's
Yeah.
healthcare.
Yes. Health prevention capability.
I hear like design kind of putting things together in a way. That's
Making
how-
it appealing and making it attractive and sustainable, all of that, yeah.
Have a question? To close? Yeah. So
Sure.
there's a couple of slides to share. Conclude. Yes, because the full 2024 series is over now, but we have already some of the topics of the next series, that is 2025 spring conversation series, laid out. So we skipped January for logistic reasons, but we have a pretty dense February, starting on February the 2nd with
It's the 6th.
6th. Oh, sorry, it's the 6th. I will change it right away. Real time edit. So it's February the 6th. We have legal design, moderated by Mr. Kim, with a annual law lab coming in and talking about this bridge between law and design research. And the 27th, is that right?
Yes.
27th, okay. We have yet another very interesting bridge between performance and design with through the lens of research. So Christian Kloekel and Grisha Coleman will moderate a conversation between design and performance. So that's what's coming up for February next year. And later, we skip March as well, because we have the design research week coming up. Can you see on the bottom, the topics every day of that week has a kind of a leading topic. So it's pathways to health, extended reality and play, designing for civic futures, designing with data and tech, materiality of design. So there is a lot to do. You can get out of this week. It's full of events, workshops, and different types of activities. And one of the days, I think it's during designing with data and tech, we will also host for the first time there will be a data sonification award. That is a joint initiative between Northeastern, our data sonification archive, speaking about repositories, and other partners that we assembled. So for the first time, these awards will be announced, and it will be part of the Design Research Week. And we have a kind of an history of repositories here at the Center for Design, so we can share that, both good and bad stories.
Always, that's
Yeah,
life.
the data certification archive is a good story because it's kind of worked to gather a community around it. So the sonification community didn't have like sort of a place to gather around. So it's really working as an attractor, and it's really working well. We have other examples that didn't work, but maintenance is always the problem. Anyway, so thank you everybody for joining us, and see you in next year.
Yeah.
Thank you.